Dr. Tracy Page, and welcome to Health Made Easy, where we discuss topics focused on hormonal health, weight loss, and wellness. Yes, you heard me. I want to make being healthier easier. Don't get me wrong, we all have to do the work, myself included, but let's make being healthy less complicated. I'll provide clear, simple, and actionable steps that you can implement into your daily life. Really, who doesn't want to feel better? If you're ready to increase your energy, optimize your well-being, and restore your health, then listen up. I love helping my patients and listeners optimize their health and clear away the brain fog, shed the excess weight, improve their mood, and really change the way they age. I am a triple board certified physician, and I created Health Made Easy just for you. Let's get started on today's topic. Welcome to episode number 14. Today we're going to talk about what you should know when you're considering a detox diet. So some of my patients are already talking to me about spring break and losing weight and also just feeling healthy in the new year and doing a reset. So I thought it'd be good to talk about detox diets or doing a detox program. And today we're going to cover what are detox programs, how your liver is open 24/7, what toxins are, and I'll give you some examples of some detox diets and also what I recommend to my patients. We'll also talk about what happens to your metabolism when you undergo a detox, and then what other health issues are associated, like what you should watch for, and who should do it, and what you should do before you start. And then I'll tell you more about what I call the Core Restore Detox Program. It's actually by Orthomolecular and a program that I recommend to my patients. And actually one that I'm doing myself. So I'm starting mine on Monday, and it comes in a 7 and a 14 day. I typically recommend the 7 day for someone who's already eating healthy and they just want to do a reset like myself. So they pretty much eat a healthy diet and they just really want to get down to some basics and kind of eliminate any processed foods and eliminate any toxins in the body and really help the liver to just maximize its phase 1 and phase 2 detoxification. Also, they have a 14-day program that I would recommend more for my patients who are really ready to make a lifestyle change, and maybe they're with someone who wants to lose weight, or they're just not feeling great and they really want to just get rid of all the processed foods and they really want to zone in on their diet over the next 2 weeks to kind of transition into a more healthy lifestyle. So both of them are great. They both have the same components, and so I'll talk about those as we uncover detox programs. So I don't know how much you know. So some of this may be repeat for some people who already know about detoxification, but the whole purpose of doing them is intended to achieve positive, healthy results. So that's what we do them for. The goal is to feel better. In some cases, some people want to look better, so they might do them to lose some weight. But I will tell you, I don't do a detox program with weight loss in mind. I do it more for health and well-being. And I would encourage you to think of it that way as well, because any weight that you're going to lose, if you go back to increasing your calories, you may gain a few pounds back. So it's not really significant weight loss that you typically see. Although some people can lose up to 10 pounds if they do, if they have significant inflammation, so they'll lose a lot of water weight. So detoxification programs, they claim to eliminate toxins, organic pollutants, and to reduce weight. And some evidence does exist that, these diets can lead to weight loss. But like I said, it's usually short-lived and it's usually fluid that they lose. But I think what's more important is that they learn what their body feels like when you remove all the processed foods and all the chemicals and additives, and you feel amazing. So that's one of the reasons why I'm doing mine on Monday and getting started. You still have to eat healthy after a detox. I think that's really important to say. You want to be careful that you don't cause what's called weight cycling, which means you gain weight right after you finish your detox. So if you go back to eating how you were eating before you started and you started eating processed foods or junk food, you're going to go back up in weight. And then if you did another detox, you're going to go down in weight. And this type of weight cycling has been associated with health risks, including impaired immune function and decreases in your metabolism, which you really don't want. There are benefits from detoxification, as it gives the body a chance to rest, and most programs allow a reset, which I like. You eliminate those processed foods and you create awareness on what you're putting in your body and how it affects your health from that standpoint. And I think that's where Detox really helps patients to understand how food is really medicine. I think a detox program that gives you healthy nutrients to eat and gives you food as options, you're still going to have a calorie deficit, but you're going to get a lot of your nutrients from your food. And that's really important because that's what we're trying to teach is that you want to get your nutrients from food. With my patients, I recommend the Core Restore Detox Program by Orthomolecular. It's a 7 or 14-day detox, and it really focuses on phase 1 and phase 2 detoxification. So it's not just about, I'm going to starve you or you're going to starve yourself. It's not about eliminating all foods and only drinking like lemon water with cayenne pepper or something like that. There's some crazy detoxes out there. It's really about focusing on phase 1 and phase 2 detoxification. And we all have the ability to take in fat soluble toxins. And during phase 1 of detoxification, we need nutrients like B2, B3, B6, B12, folic acid, glutathione, flavonoids, in order to really detoxify those toxins that we take in, and that detoxification occurs in the liver. So also we have intermediary metabolites that form, and they have to undergo phase 2 detoxification, which requires also magnesium, glutathione, B5, B12, vitamin C, glycine, taurine, all these different things. I could keep going on. So ultimately, once toxins have undergone phase 1 and phase 2 detoxification, they're now water soluble. Remember, they start out as fat soluble, and then we eliminate them in our urine, our bile, and our stool. So that's the whole purpose of a detoxification, is really to eliminate toxins. And that's why it's called detoxification. It has the word toxin in the word. So it's interesting about our liver. So we never really think about our organs separately unless we have disease or something goes wrong. But our liver, did you know that your liver is the only organ that can regenerate itself? So if they have to take out a piece of your liver, you can actually grow liver cells back, which is very cool. But the liver is really important because everything gets filtered through the liver. The kidneys are right up there as far as filtration. But the liver's open kind of like a 7-Eleven. I don't know if they have 7-Elevens anymore. When I was growing up, they had 7-Elevens. I guess it would be Quick Trip now. So I guess Quick Trip because it's open 24 hours, 24/7. So the liver is the main organ used to clear out our toxins. And it also detoxifies hundreds of chemicals. And like I said, there's 2 different phases. And we don't realize it, but the liver also has to package nutrients for us to use. So it's got like 2 different jobs. It has to detoxify and it also has to package those nutrients for our body to use. And this optimal biotransformation, that's what they call it, is really important in the liver because if it's not functioning properly, every other system, including our heart, our brain, our kidneys, and our skin, become compromised. Every other system. So most of the toxic compounds in the body, like I said, are fat soluble. So they sit in our fat cells. And kind of think of these toxins are substances that are attracted to our body's fat. So this is really interesting because when my patients start losing weight, if they have a lot of toxins stored in their fat, they don't always feel good when they lose weight. And also, too, as you can see, their hormones go all over the place when they lose weight. We hold a lot of stuff in our fat cells that we don't realize, which is why we have so much inflammation. So you can imagine if you're storing toxins in your fat cells and they're fat soluble, and then you have so much inflammation when you're overweight, and part of that is you're not detoxifying well and you have all these toxins. But anyways, the toxins are attracted to the body's fat cells, and they serve as a type of insulation on the body, the fat cells do, and kind of protects us in some ways from the toxic effects. And like I said, there are 2 phases of detoxification. Phase 1 is a series of enzymes that they basically chemically change the harmful fat-soluble toxins into substance called intermediary metabolites. So these intermediary metabolites are actually worse than the toxins that we take in. So that's why they have to undergo phase 2 detoxification that requires specific molecules that are attached to those intermediary metabolites. And this process makes them non-toxic, and it also makes them water soluble. So this way they can be eliminated in our stool and in our urine, and also a little bit in our bile. So you may be wondering, where are all these toxins and am I exposed to them and should I do a detox? Because I was wondering that too. I mean, For the most part, I think I eat really healthy, but I don't always eat organic meats. My husband loves to cook and he's an excellent cook, and we don't eat organic meat all the time. And we eat hormone-free chicken. We don't always eat organic vegetables. Things are expensive and we're just like anyone else. We think about how we spend our money and we want to use it wisely, and I think health is really important, but we don't always eat organic. We try to make sure we clean everything well. We try to eat organic, the Dirty Dozen. And if you don't know what that is, you can look it up. Dirty Dozens are the most vegetables and fruits with the most pesticides, and they're the ones that you would want to eat organic if you had the choice. So let's talk about the types of toxins that are out there and what you could be exposed to. So we get toxins from our environment and from our lifestyle, and then we have internal toxins too in our body. And some examples of external toxins include pollution, auto exhaust, solvents from cleaning products and paint, heavy metals, pesticides, herbicides and insecticides, and then inhalants. So all of those are toxins that we can take in from our environment. We also have examples of lifestyle toxins, and those are dietary choices such as fast foods and fried foods, cosmetics, nicotine, alcohol, caffeine, prescription drugs, even over the counter drugs, meats that contain hormones, and refined foods and sugars. So I have a couple of these in this category. I wear cosmetics and I try to wear clean cosmetics, but not always. I have some of my favorites, as I'm sure you do too. Fast foods and fried foods, we do go out to eat on occasion. We have a date night and we don't always eat the healthiest food. That's kind of our night to go out and have something that we wouldn't normally have. So definitely been exposed to fried foods and fast foods. Never smoked. Nicotine is not a thing that I've ever been interested in, but there are people who don't smoke that get exposed to secondhand smoke. So you have to keep that in mind. And then also alcohol. Who doesn't like a cocktail every now and then? So I definitely know I could use probably some detoxification. I'm not a huge drinker, but maybe once a month I have a cocktail. And then prescription drugs and over-the-counter drugs. I mean, who doesn't take a anti-inflammatory or a Tylenol or something of that nature? We have artificial food additives and colorings and preservatives. And then, like I said, we don't always eat organic. So some of our meats, I mean, I love a good ribeye, probably has some hormones in there that my body doesn't need. And then the internal toxins are bacteria, yeast, and fungal overgrowth. So you could have an infection, like a fungal infection in your toenails or something that you're not aware of or just haven't paid attention to. And then even when we have some undigested food and stress in our life, all of that can create internal toxins in the body. Now, I want to talk to you about popular detox diets. And I'm just going to mention one, and that's the 5-2 program. Some of my patients have done this and they ask me about it. Part of it is fasting. It kind of goes in the fasting category, which includes intermittent fasting, modified time restricted eating. It encourages people to eat normally for 5 days. And then the next 2 days, they consume food that's limited to about 500 or 600 calories. And this diet has been around for a while, and they actually have some benefits that they claim, increasing lifespan, improving cognitive function, protection against dementia and Alzheimer's disease. And I don't know if there is research to support that under the 5-2 program. I know there is research to support increased lifespan, improved cognition, especially in intermittent fasting. So if there is a component to that. And here, I don't know if 2 days at 500 or 600 calories would qualify. There are some side effects when you fast or when you do a 5-2 program, and that's difficulty sleeping. You could have some irritability or anxiety, dehydration. You could be tired during the day or even have bad breath. And that's probably due to ketosis. So with my patients, I do like intermittent fasting, and we talk about that. And I do incorporate that when I'm helping patients lose weight, or if I'm just helping them to be a more intuitive eater and to help them, especially like if they're having sugar cravings and things. And I do try to do intermittent fasting with them. Also, to my patients who have some insulin resistance is where I also like to use it. Now, the Core Restore by Orthomolecular program, I do like that one and I do use it. And we're going to talk about that at the end. And I'll tell you more about that program. So, why can detox be helpful? Well, you've probably already picked up on that. You undergo detox really to eliminate any processed foods. What happens when you eliminate processed foods is you eliminate inflammation in the body. So you have a reduction in what's called a CRP, which is a lab test. It's just a generalized marker for inflammation, and it's measured in the blood. And when we have decreased inflammation, our risk factors of cardiovascular disease and other chronic diseases really go down. So it's really important to decrease inflammation, and doing a detox program is a good way to do that. Studies have shown that when you fast, you decrease not only your body weight and fat, but also total cholesterol, triglycerides. There's even evidence in humans that lower weight is associated with consuming calories earlier in the day. So, a little bit different than detoxing. I mean, when you do a detox, you're already consuming a low amount of calories. I didn't talk about there's a longevity program. I read that book too. And they have a fasting mimicking diet where you do a low calories and your body thinks you're fasting. So you get all the benefits of fasting. It's not a detox program, so it's a little bit different. It is a program that doesn't have any processed foods. So it is another way that you could detox your body, but it doesn't focus on phase 1 and phase 2 detoxification. I think that's really important to clarify. So a detox is where you're focusing on phase 1 and phase 2 detoxification in the liver, versus when you do intermittent fasting or when you do the fasting mimicking diet. Those aren't really focused on detoxification. I mean, they remove processed foods and they remove calories, but they don't focus on phase 1 and phase 2 detoxification. So that's important differentiation. Also, too, I want to clarify that your metabolism is affected by a detox diet. And that's different than intermittent fasting because, evidence shows when you intermittent fast, you don't change your metabolism. Norepi increases, your metabolism increases. So with a detox diet, you decrease the consumption of calories. And what happens is that your metabolism, which is made up of multiple components, there's a genetic component, there's actually what you eat that affects your metabolism. But think about your metabolism kind of like as a idle car engine. That's a great way to describe it. So some cars have engines that burn a ton of energy, right? And that's just how they're designed. And that's your body. So there's some people who burn a ton of energy. And then some car engines don't burn as much energy. And your car engine is basically what I describe as your basic resting metabolic rate. So the amount of calories your body burns to create energy, to breathe, to stay warm, to pump blood through your body, and to basically stay alive. So that will be affected when you go on a detox program and you want to prevent yourself from decreasing your basic metabolic rate. So what will happen is when you go on a detox program, you automatically consume lower calories. And so you'll have some weight loss in the form of both fat and muscle. And remember, our metabolic rate is also based on how much muscle we have on our body. So I think it's important to know that your metabolism does have the potential to be affected by a detox diet. So it's just very important to manage your weight after you finish a detox diet. You want to make sure you don't let the pendulum swing to the opposite way and you start consuming unhealthy foods and a lot of calories, because that's not going to help you either. So, other than that, before you start a detox diet, I always tell my patients have a plan in place. So, set yourself up for realistic expectations. You don't want to start a detox diet when you have 20 other things going on. You're not going to have time to prep your food. You're not going to have time to sleep. You're not going to have time to take care of yourself. That's really not the time to do a detox. Set realistic expectations. I can't say that over and over again. And also, too, is I say to my patients, it's not about weight loss. That should not be the focus. That may happen as a byproduct, but that should never be the focus of why you do a detox. You always want to check with your physician, especially if you have any underlying health conditions like diabetes, kidney disease, gallbladder disease. You really just don't want to do this without any medical supervision. And I always say, adopt a long-term perspective on anything, because remember, a detox diet is just a jump start to a healthier lifestyle. It's not a long-term diet to follow. I'm going to do the 7-day Core Restore detox program, and it's for 7 days, and then I'm done. I'm not going to do it again and again and again. Now, will I repeat it again in the future? Possibly, but I don't feel like I need to do it again the next week or not even the next month. It might be a month or two before I repeat it. During all of these things, always be kind to yourself. We just were doing some finishing things about our new practice, and We have a wall. It's kind of like I forgot what the architect called it, but basically it's like the first wall patients see when they come through the lobby, like they're in the lobby and they come into our practice. And the last line on that wall says, "Love your body." And I love that because, that's so important. You can't white knuckle yourself through anything. You can't hate yourself through anything. You just have to love your body. I mean, you have this beautiful, wonderful body that gets you where you want to go, that allows you to have feelings and thoughts and experience the wonderful thing we call life. So just really love it and take care of it and do things that nurture it. And so that's why when I say doing a detox, shouldn't it be about losing weight? It should be about helping your body function to the best of its ability. And that means your liver. So let's talk a little bit more about Orthomolecular's Core Restore Detox program and why Orthomolecular. So I have chosen Orthomolecular to be my main supplement company that I use inside my practice. Now, my patients have exposure to other supplements and other options, and I discuss those with them all the time. But I've just chosen to carry one brand, and I chose them because they use science. They really care. They think efficacy matters, and that's why I chose them. And you'll hear about them during my podcast on several different occasions. And so I chose them and I like this program, Core Restore Detox program. The program, like I said, is 7 days. It's great for those who are already eating fairly well and they just get off track and they just want to get back on track. The 14-day program, I like to use that for my patients who really need a jump start to get on a healthy pathway and they need just a little bit more structure for a little bit longer time. So that's what I would use that for. In the Core Restore program, it really comes with a lot of good information. It comes with a booklet. It has a patient handbook that talks about the liver and how the liver detoxifies. It's very patient friendly. And it talks about the path of detoxification in the body. It's really made to help restore the body's detoxification and elimination function. So that's really what the program is about. And our diet can lack nutrients necessary for both phases of detoxification. So the Core Restore program provides the body with essential support to detoxify. It includes macronutrients, vitamins, minerals, phytonutrients, clean protein, which I think is important. And the program can be used, like I said, for further GI support. It can also help you figure out if you have some food sensitivities that you may not know, because they also give you information on elimination diet, which I talked about in another podcast. They have a host section in the booklet that they give you that has foods and a dietary plan to help decrease your risk and exposure to pesticides, herbicides, artificial colors and flavors, also preservatives and other chemicals, which we don't even think about when we eat. But there's all kinds of stuff in our food, especially our processed food. And there's a big emphasis in this program on cruciferous vegetables like broccoli and cabbage, both of which we know not only are they hormonally helpful, but they've been shown to promote phase 1 and phase 2 detoxification. You didn't know that your liver works so hard, did you? The Core Restore program also includes, like I said, the elimination diet, so you can identify food allergies. And it just really helps you restore your GI function and help reduce inflammation, which I love because I will tell you, every disease, the root cause of disease is inflammation. If we can get rid of inflammation, because inflammation affects us at the cellular level. So it's such an important thing that we need to get a hold of. And anything we can do to bring down inflammation in the body is going to help you live longer and healthier. In the handbook, they do give you a list of foods that increase detoxification. And what's nice is they give you a list of foods to avoid that also decrease detoxification. The kit is really all inclusive. So it has a Core Restore protein powder mix that includes high quality dietary fiber. And I don't know if you know this, but fiber helps us stay regular. But Americans consume less than half of the daily recommended amount of fiber that we need. So we need at least 25 to 30 grams a day. And just think about it. Most of us take in half of that every day. And I know I've been guilty of it. Right now I use chia seeds. They're my favorite. So I put chia seeds in my smoothie. And if I do a fourth of a cup, that's 20 grams of fiber. And I'm like, okay, that gives me 20 grams to start with. And I can get the other 10 grams in on my own. So that's a really nice way for me to get in the dietary fiber that my body needs and that your body needs. The Core Restore program also comes with, it's called a PhytoCore dietary supplement. So it's just made of artichoke and going to have some other things in it, beet leaf and dandelion root. And these things can help to cleanse the liver. So it's very natural. It has inositol and methionine, which also are what's called lipotropic agents that work to transport fat out of the liver, which is good. And it supports both phase 1 and phase 2 detoxification. And then the other thing they have in there is called alpha base, which is a multivitamin and mineral supplement. Because remember earlier in the podcast, I told you all those different vitamins and minerals that we need in order to have phase 1 and phase 2 detoxification occur. It also includes a high dose antioxidant and vitamin C, E, and zinc to protect our cells. So it has all the stuff that you need to be able to do a detoxification. So I really like it. I think it's simple and easy for my patients to follow. And then they eat real food in the process. So how it works is that you have a shake in the morning and you have a shake at night, and then you eat a meal in between. And like I said, they give you a nice list of things and they give you a list of snacks and different things that you can use. So I'm not here to sell you on Orthomolecular's Core Restore Detox program. I just use it as an example as what you should be looking for when you decide to do a detox. Now, if you Google detox programs, you'll find a whole list of some crazy stuff out there, like drinking lemon water with this cayenne pepper. And you'll find ones where you'll do like a master cleanse, and you may do saltwater enemas and all kinds of crazy stuff. So the reason I want to do this podcast is to really just drive home the point that you can do a detoxification. You can, for lack of better words, cleanse your liver. You can focus on phase 1 and phase 2 detoxification and eat real food. And it can hopefully jumpstart into a healthy lifestyle. And it's not a bad way to start. So if you have questions or you have concerns about something you want to try, don't hesitate to reach out and ask a question. But this is really just to inform you that it can be safe. Just use a good program and find something that is really going to focus on phase 1 and phase 2 detoxification. Like I said, our liver is open 24/7. So it's like our local Quick Trip. I think that might be something that's special here in Wisconsin or the surrounding area, but it's just like a convenience store that's open 24/7. So think of your liver that way the next time you eat and the next time you drink and the next time you take in foods or you're exposed to things, that liver is working really hard for you 24/7. And so you want to give it some love, do something nice for it, and help it with phase 1 and phase 2 detoxification so that it can work for you until you're 60, 70, 80, 90, and beyond. Okay. So go be healthy, be well, change the way you age. You can do it. It's all based on what you do, what you give to yourself. And remember, just like the saying on my wall at work, love your body. It's the only one you have. Take care. This is an important reminder. The podcast is for educational purposes only and is not a diagnosis or a prescription for care. Please consult with your healthcare practitioner before moving forward with any of the therapies or treatments discussed in today's podcast. If today's topic resonated with you and you want more information, please check out our website, wisconsinfunctionalmed.com. All one word, wisconsinfunctionalmed.com. Also, for those of you who want further assistance with weight loss, consider our online weight loss program called The Pause, which can be found under services. We really focus on helping you reach your weight loss goals. We provide a supportive and interactive and engaging environment, which is led by me, Dr. Tracy Page, so you can get all the help you need. Remember, you can change the way you age, and I'm here to help.